So Natalia, welcome to Levitas.
Thank
It's a
you.
real pleasure having you here. Basically, you've come from a world where you look after people's hair, the health of their hair, the growth of their hair, improving hair, and you're passionate about this. And that's one thing that attracted us to you, that you just don't look upon this as a one-off thing. You look at the whole body, the physiology, and your results are amazing. Those had some phenomenal feedback. So tell me a little bit about your history and what brought you to this passion.
So my background is hairstyling. I worked in fashion for 20 years. But me, being the Brazilian girl that I am, we love hair in Brazil. We really look after hair. And I was always wanting to do something that was more long term. So I thought, oh, I'm going to open a hair spa. And then I got pregnant, had my baby that I got a bit pushed to the side. And then trichology became a thing, more like 2020, like when everybody was in COVID and it just became huge. And I was like, oh my God, this is exactly what I need to be doing. And my God, I never looked back. I feel like it's such satisfaction from helping people, like it goes such a long way. People are so vulnerable when they're losing their hair. And I'm always looking for what is the best approach, how deep can we go, how can you optimize your hair and it goes into your health. So like I went into like a much bigger world when I first started, you know, like it seemed so limited, and it's a huge industry. And also like now going into how medicine is going and its prevention, and I was like, yes, it's actually what I want to do.
And I would describe you as an ambassador for good hair. I think you have clients both in London and across in the US as well, so a lot of experience on an international level. And Brazil has a great reputation in terms of the things that are happening. So it's a very nice international experience that you're bringing to Levitas, which is great. We've been doing hair work for about 10 years, and my belief is that the hair reflects the internal health. So when people are stressed, we see more intelligent hair loss, the head gets more inflamed, we lose hair, and we kind of think this is normal. So men particularly, and possibly women, they think, oh, after a certain age it's okay to lose hair. That's not true though, is it?
It's so not true, so not true. So the way that I approach hair loss is bespoke to each person's DNA or your health. I'm gonna look into that. You know, even if you have intelligent effluvium and you're stressed, oh my God, yes, you have genetic hair loss, but then you have something else that brought that forth. So I like to dig deep, and my approach is not one fits all. It has to be bespoke to each person's DNA. And I truly believe that you being healthy, it will, you know, then translate onto your hair. So I started doing things looking into longevity and gut health and hormonal, which wasn't being done. It was just like it was so easy for me to put two and two together. Oh my God, alopecia areata is an inflammatory condition. It's from autoimmune. Why isn't anybody doing like autoimmune treatment? Why are we not referring these patients to like specialized doctors and working together? I'm not interested in just doing like top good treatment, take your money, bye-bye. No, I want you to have your best hair. I want you to know how to put a lead on your condition and manage your condition for yourself. And I'm here just to assist you throughout your journey.
Fantastic. Well, that's exactly the sort of value system we work on. It's interesting in the sense that with hair, there is this feeling that it is all linked to what we're eating and what we're drinking. But in fact, sometimes there's an internal mechanism for failure, isn't there? You mentioned the gut, and I was particularly interested because that's where 70% of our immune system sits. So if you have a bad gut, the body's having to pick up a load that normally it wouldn't. And you're the first person I know in the hair world that have actually written nutritional books on hair, which is incredible. I've seen the books, they're wonderful. So by controlling the gut, by good diet and probiotics, by fixing the gut, the hair can get better.
Yeah, absolutely. And also, you know, it's not just looking at one thing, it's the 360 approach. Yeah, so if you have a problem with the gut, usually it's not just one thing. It's one that then goes into the other. So, you know, look into your liver, how's filtering your toxins, and then it goes into your hormones, can affect your hormones as well.
So you described that beautifully, because when the gut doesn't work, the body doesn't let you down, the poor liver has to work overtime. When that gets overloaded, there's more inflammation. The body uses energy, so it steals immune energy, hormonal energy, and we go into decline. And the hair can be a radar of that decline.
The hair always suffers. It's not even recognized as important tissue by our own body. So they're always like, oh my God, if there's anything else going on, the hair will suffer. So then again, if someone comes to me, oh my God, my hair is shedding. Yes, I can do PRP, I can do that, it will help stop shedding. I'm not really looking into what is causing that. So I started to work with Sasha Lamscon. She helped me write the books, the nutritional books, because I had to look into nutrition and doing the DNA testing for nutrition even before I give out medication for hair loss. I'll do this both to the person's DNA because people may not even respond. So I feel the way that medicine is going, and even though hair loss, the way that trichology is not medicine, it needs to be together, and we need to look into prevention more and looking into longevity, like it's your best health that will affect your hair. But it's you knowing what is going on that is affecting your hair. That is just like a flag sometimes, it's
Yeah, no, I think that's fantastic. I mean, certainly that sort of resonates beautifully with what we're talking about here at Levitas, precision medicine. Now, I know that you treat each patient individually, and it's not one answer, but just to understand, if I gave you a couple of scenarios, and whilst we know it'll be bespoke, some general advice on certain individuals. So females after having children, for example, they find that their hair gets straw-like, they lose hair. What sort of strategy do you put in place for someone who's losing hair after sort of children, people?
A consultation goes such a long way, because I'll make a plan according to each patient. That would be, how much is bothering you, how much you want to invest, and then we'll work with them. There are some hair tonics. I love Horizon, the trichological brand. If you want to go natural, if it's something that's just gelatin and fluvium, that will help me boost blood circulation on the scalp. And then if you want to do some PRP to prevent the shedding to go further than it needs to go, then that's just gelatin and fluvium. That will help me boost blood circulation on the scalp. And then if you want to do some PRP to prevent the shedding to go further than it needs to go, then we can do that as well. But that's going to be according to each patient, what they can or can't do.
Yes. What about internal health, like thyroid or low iron and things like that? Do you find that?
Low iron is so big on women.
Yeah.
Some women, they've been tired their whole life, and they don't even know the difference. They don't know they've been deficient in iron their whole life. Yeah, so that is very common. So then I will say, look, let's look at your history, and then if you have a predisposition to not naturally store iron, do yourself a favor, invest on. If you don't want to do the treatment for the hair, which once you look after this will improve, go and do an iron infusion. That will benefit your whole life, your lifestyle. You're going to day and night.
Yeah, well, certainly we're an iron infusion centre. We found the same as you have. And then, of course, hormones, they affect hair, right? So,
oh my God, yeah. So right now, I want to start talking more about menopausal hair loss. After you hit menopause, the hormones change that actually affect the growth cycle of your hair. Yeah, and you can also it causes I call the menopausal hairline, which is specifically around the hairline. It gets thinner.
The whole hairline?
Yeah, the whole hairline. I'm working on something I'm going to be able to share soon. As women, I'm 38 years old now. No one, thank you. No one my age is studying, trying to inform themselves about menopause at my age, which is wrong, because then it hits you. You don't know what you're looking for. You don't know you're having symptoms. You may have symptoms for years and you don't know that's your menopause.
You go into that world and think it's normal.
Yeah, so I believe in everybody in your lane. I wouldn't, attempt to, treat anyone with the, hormonal problems. So that I was sending to you.
Yeah.
So it's about working together. I feel it's a combined work,
I agree. We formed Levitas one for this reason, that longevity is a community, and we want the community to grow. It's not about looking inwards, it's about looking upwards, and which is why you're here today.
Yeah.
So we talked about post-delivery hair loss, we talked a bit about menopause. What about men? Tell me about the men, because men tend to react to this maybe in their 40s or 50s, but now we're seeing guys coming in their 20s and 30s with male pattern balding. Can you help these people too?
Yes, absolutely. So with genetic hair loss, we have a sensitivity to dihydrotestosterone, and it's called pattern hair loss because it has an actual pattern on the scalp. The areas that are more sensitive to dihydrotestosterone. For females, it starts like a Christmas tree shape, like here. You just start seeing your scalp a little bit more. For men, it's the hairline and the vertex. Yeah, and then it can spread out. In men's cases, you can have a whole smooth area where the follicles are destroyed, and then that's as far as I can go. Beyond that, it would be a hair transplant. So, what do? The sooner you treat, first you have to acknowledge it, go and do something about it. Like men, I feel like they're very proactive. They go get a headache, look online, get a medication. They hate you coming sometimes. It's so hard to get on the chair because they need to see all the proof, the science. So, but the sooner you do something about it, the better results you're gonna have. You don't have to lose any follicles in between. If you start with the right medication, do some treatments to just, if you start young, you just have to do some boosting treatments. You don't even need to spend that much.
Yeah.
The later you leave it, the more needs to go into it.
Yes.
And the results may not be as...
That's good.
Yeah.
I think you're right. You don't want to, the follicles can be dormant, but you don't want to lose them, because once you've lost them, it's hard to work with.
Yeah.
And again, of course, with hair, it's once you get it in the right place, it's about maintaining it.
Yeah.
So we have to grow it, then maintain it. And it's a bit like looking after your teeth. You have to brush them every day, right? So same with hair, you've got to keep feeding it correctly. That's fantastic. So a couple of new things in the hair sort of market, and I just wanted your opinion on it. So exosomes, everyone's using exosomes. Have you had good experience with exosomes?
I love exosomes.
Yeah.
So I'm actually brand ambassador of E50 exosomes.
Right.
Because it's such a big market, and now everyone is talking about it. So many brands, they're doing it to age. The cells are not communicating as well. So all it does is enhance the communication between the cells, and it's regenerative in a cellular level. So it's rejuvenating at a cellular level. I like to combine things. I'm like throw everything at it kind of girl. So even my protocol, like I have 4 different treatments that goes into my protocol with high frequency, exosomes, PRP, and LED light at the end. Yeah, because I want to boost the blood circulation there, makes the skin a little bit antiseptic, and also it makes it more safe for the treatment. And then I like to combine them. Just, don't waste time. 360 approach that will have the medication on the side, supplements that will be bespoke to each person. Don't take supplements if you don't know you need them.
So we talked about exosomes, and you mentioned you use PRP too. Do you like PRP?
I love PRP. I feel like we're a little bit limited when it comes to PRP because then age has a role to play. Yeah. That's why I like to
the quality of the blood changes.
Yeah, so as you age, your health.
Yeah.
As much as people sometimes come, great. So if I can, of course, it all ends up costing more. Yeah. If I can choose, one protocol would be combination.
Right.
But I have great results with both.
And what about polynucleotides?
I don't use polynucleotides because I feel like exosomes. I feel like it's a bit more sophisticated.
Yes. No. I think we use polynucleotides for facial aesthetics and for hair. We had some good results, but I think what I find is that it's a bit like your diet. You need to keep it diverse. And even treatment plans, you kind of, like you do, you kind of hit it with different angles, and then you cut it all around. So,
do you like it switch it up as you go?
Yes,
you don't have...
I certainly use exosomes, I use polynucleotides, and I use PRP, and occasionally I do stacking sort of treatment plans where it'll be alternating exosomes with polynucleotides. I tend to give carboxytherapy with everything. I sort of basically inject carbon dioxide into the scalp, create that vasodilation, blood flow, then give the treatment.
I use that, but more superficial because I use with the machine, the plasma. We talked about it. Also boosts blood circulation. But I'd love to do the injectable one. That sounds amazing.
We've been using that for 10 years with great results. The other thing we do is try and limit inflammation, internal inflammation. So we work a lot with sleep, a lot with hormones, a lot with gut, all the things that you're doing. So I think this combination of fixing the inside and the outside leads to phenomenal results.
Yes. Yesterday I had this patient that she has frontal fibrosing alopecia, and
it's hard to treat.
Yeah, so it's cicatricial. Yeah, and then I'm very honest. That's always my approach, and I said to her, "Look, this is what's happening. This is the condition. Here's what we can do." And working in prevention, like this is an autoimmune condition, so she's gonna have to look into her health. So it's not only her hair doesn't go. Of course, that's another factor, but it's her general health. That's what I try to, explain to my patient. Like, this is going to affect your whole life.
Well, everything happens everywhere at the same time. So if you pick up the sign of inflammation in the scalp, the body's inflamed. And that's what we work with. We fix the defense of the gut, detox the liver, fix the hormones, fix the circadian sleep, and then essentially people get better with everything.
My heart always goes on when I see this condition like this, especially with frontal fibrosing alopecia. Normally hits mostly women as they hit menopause, the hormones change. You can lose a whole band of your hair.
I've seen it. It's not great.
It's not great.
It affects your confidence, it affects your mood, and great work you're doing. We're very pleased to have you as part of the Levitas family and heading our hair restoration procedures and processes. So we're very excited.
Thank you. I'm very happy to be here. I'm very excited about our journey together.
Great. Thank you.